Hi, I'm Dr. Pranitha, consultant neonatologist and pediatrician, advanced certified lactation professional, KIMS Cuddles, Kondapur. Let us discuss about tips and tricks for expression of breast milk. So, expression of breast milk might be required for a mother if her baby is sick, premature, low birth weight, or baby is not able to breastfeed directly because of any other condition. So, in these cases, milk expression can be done either manually with your hand or it can be done with the help of a breast pump. Breast pumps are also of various kinds. There are manual breast pumps, hospital grade breast pumps and electronic breast pumps. So you can take a breast pump which suits your needs. Usually hospital grade breast pumps or the electronic breast pumps are the best form when compared to manual breast pumps. So whenever you are pumping with a breast pump, it is important to first stimulate your breast before pumping. So stimulation is done basically for stimulating the milk ejection reflex. Once the milk ejection reflex is stimulated by massaging over the breast, then we need to start pumping. So pumping needs to be started usually on day 1. In the first 1 hour of life, it is best started so that the amount of milk expression is usually sustained. And breast milk expression is also to be done at least 8 to 10 times per day. And each session of pumping needs to last for at least 20 to 30 minutes on both the breasts. So double pumping is preferred when compared to pumping single breast at a time. And also once you pump, it is important for you to also select a flange which fits your breast correctly. So how do you understand which flange is correct for your size? If the nipple is moving freely into the flange to and fro with the pumping, it means that the flange is appropriate size. If you feel that the skin of the nipple is touching into the flange and it is kind of painful for you, it means the flange is usually small. And if the nipple and the areola as well is moving into the flange with pumping, which means the flange is usually large in size. So select a flange which is appropriate for your size. So once you are pumping, after stimulation of the milk ejection reflex, start pumping simultaneously on both breasts. So whenever you are pumping, simultaneously massage your breast also. And after the end of pumping, the breast should feel soft and there shouldn't be any lumps felt in the breast. That means the breast is completely expressed. So coming to manual expression of breast milk, manual expression is sometimes more simpler and more effective when compared to pumping, especially in the first few days of life. So don't expect milk to flow in a jet as soon as you start expressing the milk, because that doesn't happen in the first few days. Also, whenever you are expressing manually with your hand, the thumb needs to be placed 1 inch above the areola and the rest of the 4 fingers need to be placed in the downside of the areola, again 1 inch below, and always push towards the chest. So you are going to push towards the chest and gently compress both the fingers. So this is the movement you are supposed to do in each quadrant of the breast, at least for 5 minutes in each quadrant, and the whole session should last at least for 20 to 30 minutes. That is only going to ensure the effective milk expression. And power pumping is another method which can help in increasing milk production, and this is also already discussed in an other video.